Let's check in some of the stories in healthcare because they seem to be dominating the news over the past couple of days. We talked about a little earlier on when I asked you what you think of this plan announced by the health minister, Christian Dubé, yesterday, where graduates here, medical student graduates, would be forced to stay and practice in the public system for 5 years. And if they didn't, they would face pretty hefty fines, $200,000 a day at the top end. A day, by the way. Talk to Aaron Derfel about that and a couple of other stories. Aaron, thanks for being here. Appreciate it always.
Yes, my pleasure, Aaron.
So let's get started with that. I want to know what you think of that because when I asked the question, I pointed out, we don't live in a vacuum here in Quebec. These sorts of things are issues in other places in the world. Some use the stick approach as Quebec does. Others use the carrot approach. What do you make of what you heard from the ministry yesterday?
Well, I wrote about this over the summer that Quebec had the highest number of doctors who had quit the public system. I think it's just a handful in the rest of Canada, and it's something like 700 or 800 in Quebec. So it had been increasing. But this measure, I think it's optics more than anything because it's talking about new doctors. That's not really the issue. I think the issue right now is doctors who are opting in and out of the public system. They'll work as a surgeon, an orthopedic surgeon in a hospital for a few months, and then they'll opt out of the public system and then work at a private orthopedic hospital for 2 months. That's something that the minister could have done. So it sounds at first glance impressive, but I have my doubts.
Okay, so listen, when we had a couple of callers who pointed something else out, and you would know this, I think. The idea that the government is focusing on this because it's a problem in their eyes, and it's easy to say that when you say Quebec taxpayers are subsidizing these people to the tune of hundreds of thousands of dollars a year. But then the fact is pointed out that, let's take Montreal as an example. Doctors who are here, who've retired, who've left the system, are not even being replaced. So Montreal is short a number of doctors. So it's not a problem of those graduating who don't want to stay here. We're not even filling the positions that are open right now.
That's also true, but what your listeners should realize, if you want, for example, if you need a dermatologist, it's impossible right now. You're going to have to pay out of pocket a few $100s to see a dermatologist, and your private insurance will not cover that. It's a real problem. These dermatologists are quitting the system, and it's actually, in my opinion, quite scandalous. Because it raises issues of access, and as I said, you're going to have to pay out of pocket. That almost happened with my daughter, and fortunately we were able to find a dermatologist in the public system. So it is a serious issue. Yes, the underlying problems are, you can trace them back to poor management a decade ago, 15 years ago, when we knew that the population was aging. We knew that the population would have more medical needs, and yet we were reducing enrollment in medical schools, or not increasing enrollment when we should have been increasing enrollment. And now belatedly we're doing it, but it takes 5 or 6 years to train. So that's a structural issue that reflects poorly on, or rather shows the mismanagement by the authorities. But make no mistake, there is this exodus of physicians in the public system moving to the private system, and what they're doing is, as they leave the public system, they're making the public system worse. People are having to wait longer for all kinds of things, and it's a real shame because there's just a limited number of doctors, and the doctors who are quitting the public system, they're doing it, say, like in the case of orthopedic surgeons. What they're saying is that they're not being given enough operating room time. So in the public hospitals, so that's why they opt out, and then they go and they do those operations in the private system.
Right.
Again, that reflects poorly. And then it was today that the minister announced that he's signing contracts with these private clinics, surgical clinics, to do these operations. You won't have to pay out of pocket as a Quebecer, but it's costing the state more money. It's just, mismanagement after mismanagement, I'm afraid.
I was going to ask, based on what you just said, this seems a little bit of smoke and mirrors, right? Let's look at the graduating students and shift the focus from all these other problems we have.
Yes, exactly. I really think that this was a politically astute move on Dubé's part to create the impression that he really cares about the public system when, in fact, under the CAC government, they've been moving more and more and more towards privatization and a two-tier healthcare system.
Let me talk about another piece of news today out of the healthcare system as well concerning bilingual institutions. So, we went through this sort of situation with Jean-François Roberge months ago. He clarified, you'll remember at the time, I think we spoke about English services. The premier went on and said, don't worry, nothing, Anglophone services will not be affected. And then today, seemingly out of nowhere, the OQLF updates his list, official list, of bilingual hospitals in the province. I'm curious what you make of that.
Well, I don't want to toot my own horn, but I guess I have to. All of that, arises from the reporting I did over the summer, because I pointed this out, that the OQLF was disregarding or violating its own law, which required it to publicize a list of bilingual institutions founded by the Anglophone community on its website. It didn't do it, and I wrote about it, that at the time. And then what I think happened was, you'll recall, near the end of September, Roberge reversed course. He dropped that odious English language eligibility certificate for historic Anglophones to receive healthcare in English. And at the same time, they made that change on the website of the OQLF. I didn't notice it. And then, for whatever reason, I was speaking with the editor-in-chief of the Gazette, Lenny Lucci, who's just an amazing editor. We were talking about these issues, and I said, let me just check. And I went up on the website, and sure enough, they had changed it. And to their credit, they've actually expanded the list. So it used to be 69. It used to be something like 39 institutions, and it went down to a dozen. They had never relinquished their status, their bilingual status, and now they're back up. And it's like when you include the Montreal Chinese Hospital, Santa Comini, it's something like 73. So this is really good. It's an important issue, because when people want to know, we have to protect our institutions. The CAC government, unfortunately, with Concordia and McGill, it's many people say that the government is going after them, and we have to protect our institutions. And having this list, which the Anglophone community fought hard for, having it publicized in conformity with the French language charter, that's actually a great thing.
Yeah, and by the way, it's not just one or two. We went from, a dozen, from 12 to like 73?
Yes. Yeah, so
it's significant.
When you would go on the OQLF website, you just think, okay, it's just a dozen. And what that means is that these are institutions that can produce that can hold meetings in French and English. And I don't know all the ins and outs with Bill 96 that you're now required to in terms of documentation, but certainly the meetings could be held in French and English, unlike, say, the Centre Hospitalier de l'Université de Montréal. So, the McGill University Health Center, Jewish General, the Douglas Mental Health University Institute, the Lakeshore.
Right.
Their boards can. When people are sick and they need to be cared for, they want to be able to speak in their mother tongue. So this is so publicizing this. It's a good thing. It's surprising because the CAC government, for the longest time has been arguing, French is in an inexorable decline on Montreal. I believe that's very, very debatable. In fact, the OQLF commissioned a study that showed that at least in the healthcare sector, the use of English has been declining and French has been increasing. So this is, at least when it comes to healthcare, this is progress, and it's the result of local accountability journalism. Please, everyone, subscribe to the Gazette.
No, yeah, absolutely. Good work from you. You've done such great work in the health file. But you know what, Anglos, we can take this, and also immigrants as well, can take this as a victory now that these have been officially listed as bilingual institutions. So we'll take that as a win. Aaron, thanks so much. I appreciate it.
My pleasure.
Take good care. Aaron Derfel of the Montreal Gazette.